So a lot of us initially hoped that a ketogenic diet alone would treat cancer. Some of the earlier mouse data showed that it may, or at least slow its growth, but the data is not really showing that to be the case. So it doesn't mean all is lost. A lot of these treatments by themselves can't treat cancer. For instance, GBM, glioblastoma, the treatment for it is multifaceted. Patients get surgery, patients get chemotherapy, patients get radiation. Not any one of those by themselves works very well. All of them together does not work as well as we want it to, but I think a ketogenic diet's probably same as that. And Gene Fine, Dr. Fine, and a lot of other people, I think, have similar viewpoints now. Can it manage cancer? That's kind of a buzzword, which no one really knows what manage means. Can it slow its growth? Can it make it stay in a place where it doesn't cause any issues? Some of the mouse studies have shown that. I don't see that happening in people. This is why human studies are so important. And we did a meta-analysis on all of the mouse studies that was spearheaded by Rainer Clement, the guy that's doing a study in Germany right now. That's exactly what we found. So by itself, it does not treat cancer. It does enhance current treatment, so chemotherapy and radiation, and that was a lot of Dr. Sheck's data, so it makes sense that she's running that trial now in humans. What we did see is when the ketogenic diet was implemented prior to implanting the cancer cells in a lot of mice, it did reduce the risk of those mice getting cancer. So again, these are all animal studies, so we can't make large conclusions, but the data that we saw, along with data from about the past 100 years, data that's accumulated, it probably is a strong way to reduce the risk of cancer. And there's no human studies to back up that comment, but I'm hoping that that's the case, and I think there's ample animal studies to show that it probably does reduce the risk of cancer by itself. But in terms of treating cancer, it needs to be done with other agents, whether those are metabolic agents that we don't know about yet, whether that's chemotherapy, radiation, surgery. We're not sure, and it's probably very different for different types of cancer. So it's not one size fits all.